Hi friends, I Robinson. Welcome to our YouTube channel Star Science Robinson. Let's get into the topic. Inguinal hernia. So what is inguinal hernia? The inguinal hernia can be also called as a groin hernia, and the inguinal hernia, it is a condition in which soft tissue bulges through a weak point in the abdominal muscles. So the soft tissue is often part of the intestine. It's easy to see and feel the bulge, although not all are visible by the patients, especially when obese. Then now we are going to see in our diagram where the inguinal hernia exact position. I'll try to show from where the inguinal hernia. So now I'm showing you in our diagram. This is the place where it will have a bulges through a weak point in the abdominal muscles. So right now I'm showing you this is the place, and we'll see when it bulges what are the content will protrudes out. So this is a abdominal muscle, so where the intestine or a fat content will protrudes from this particular point, as we seen in our previous diagram. So now I'm showing you, so when it bulges, so what all the content it will come out or it will bulge through that portion. So in abdominal muscle there are three muscles, so which is being inner, it is a transverse fascia muscle, and it has a internal oblique muscle and external oblique muscle. So which are the weak point of the abdominal muscle where the intestine will bulge into that particular point. So right now I'm showing you the intestine which is protrudes into the muscle area where the weakness point of the abdominal muscles. So I'm showing you this is the bulging of the intestine. So abdominal muscle, as we seen, the transverse fascia and internal oblique, external oblique, and the subcutaneous and then skin. So now we are seeing the place where the indirect and direct hernia will protrude. This is a indirect hernia. So indirect inguinal hernia, it occurs due to weakness of the abdominal wall. So the hernial sac protrudes through internal inguinal ring into the inguinal canal and often descend into the scrotum. So that is the thing which is seen in our diagram. So second, we are seeing about the direct inguinal hernia, which is not passed into the inguinal ring. If it is a direct hernia, then it is medially to the inferior epigastric artery, and if it is indirect hernia, and it is a lateral to the inferior epigastric artery. So this is deep inguinal ring, where the indirect inguinal hernia occurs when abdominal contents such as fats or intestine pushes down along the inguinal canal. This is inferior epigastric artery. So the indirect inguinal hernia are present to lateral to this inferior epigastric artery. Right now I am showing you the bulging or protrusion of the intestine, how it passes to the deep inguinal ring. So now you just remember this intestine, it enter into the peritoneum and then transverse fascia, and it will pass into the internal oblique, at the same time external oblique, and it will protrudes into the scrotum. It follows the somatic cord to enter into the scrotum. So that is the thing which we are seeing here. So this is the main thing when it enters into the scrotum, where it will enter the superficial inguinal ring and then it will enter into the scrotum. So this is how the indirect inguinal hernia occurs. So now we are going to see about the direct inguinal hernia. So the direct inguinal hernia, the main thing you have to remember about, same diagram, but the thing you have to remember is where the direct inguinal hernia present medially to the inferior epigastric artery. So now you are seeing in our diagram, it is not entering into the deep inguinal ring, weak space which has thinned out in the abdominal wall. In this case, the lower abdominal wall, the sac of the intestine will protrudes in, but it will not enter into the superficial inguinal ring. So that the thing which I am showing you right now. So it is very important to remember where it is having a medially to the inferior epigastric artery, so that is called as a direct inguinal hernia. So that is about the inguinal hernia that which we have to remember about. Thank you friends for watching this video. It's Star Science Robinson. Thank you once again.